Prakash to kindly chair this session.
Good afternoon, everyone. The speaker for this session is Dr. Bobby Antony, completed his BDS from JKK Nataraja Dental College, Tamil Nadu. He completed his advanced curriculum certificate in immediate functional loading from Implant Foundation in 2014. Went on to complete clinical masters in 2019. He's also co-authored a scientific paper, Use of Bicortical Screws to Treat Atrophied Maxilla, which was published in November 2016. He is a consultant implantologist to several clinics in Kerala and abroad. He is also regularly trains dentists in this exciting field of strategic implantology. Welcome, doctor. Kindly start your lecture.
Thank you. My name is Dr. Bobby Antony, and my topic today is how to avoid sinus lifts using cortico-basal implantology. These are the topics we'll be covering: introduction, maxillary sinus, know your enemy, sinus lifting, is it worth it? How can cortico-basal implantology help? The disciplines governing, the placement techniques, and I'll be showing a few cases and our conclusion. So to begin, as an implantologist, when you get a lot of maxillary reconstruction with implants, the first thing you do when you get a case, you look at the maxillary sinus. Okay, how far is it? How deep is it? How am I going to place my implants? So you send the patient for a CBCT, and this is what you see. So how will you rehabilitate this patient with implants? This question is to the other implantologist, not the cortico-based implantologist, but how would you restore this? The only way for a conventional implantologist to do this would be to do extensive sinus lift and sinus grafting. We respect the maxillary sinus too much. We consider it a glass ceiling which should never be broken, or a Bermuda Triangle which we should never ever enter. With the help of cortico-basal implantology, I hope to break through this glass ceiling, and we can complete a case within 72 hours and give immediate functional loading teeth to our patients with cortico-basal implants. Okay, how do we go about this? If you know the enemy and you know yourself, you need not fear the results of 100 battles. This is very relevant in today's implantology because many of the implantologists, they know so much about the implants, the surface of the implant, or the design of the implant, how the surface is coated, etc., etc. But many of them don't know about the bone. This is the medium where we place our implants. To be a successful implantologist, you should know about bone and bone physiology and how the bone reacts to your